we're going to do a topical patch. Now, everything that I told you before applies here. We've got to check the order. We've got to do 3 checks on the patch. You've got to introduce yourself, do 2 patient ID. All those still apply. But once at the bedside, you're going to say, I've got your nitro patch, Mr. Sim Man. Do you know where your other one's at? And he said, well, I think they took that off last night. I said, well, that's good, but let me look. So when you're doing a topical patch, you want to put it on a hairless place without scars or lesions. It can be upper chest, the top of the arm here, and the top of the back here. So be sure you check to make sure there's not an old patch there. The old patch, go by policy at the hospital as to how to dispose of it, if there is one. Medications that can be given by patch are, this is nitro. We can do fentanyl by a patch. We can do scopolamine by a patch. So be sure you know what drug it is, what it's for. So we now know he doesn't have an old patch, and we know we've got the right one, and it's supposed to go on this morning. Be sure you wear gloves, because if it's topical, it also will go absorb through your skin. So you don't want any of this nitroglycerin to go into your body. And the big side effect to nitroglycerin is a headache. So you don't want a severe headache. It'd be a patch like this. We need to date it and sign it before we put it on, because that way the next shift will know it was put on at 9 this morning and it needs to come off at 10 tonight. So today at 0900 and your initials. And we're going to put it right up here and kind of hold pressure so that it adheres. And it looks like it's fine. Is there anything else I can get you? And you're done. Okay, now that you have finished putting the patch on and you've signed it that you gave it, when you get out of the room, you need to document on the nurse's notes where you applied it, so that the next person should have a good idea of where it's at. Now, if you were going to do lotions, you would need to put those on with a cotton ball and gloves and just dab it on any lesions, kind of like calamine lotion for poison ivy. One other application could just be creams or ointments, especially for skin breakdowns. Wear gloves and use either a glove finger or a tongue depressor to apply it.